Hello everyone, I'm Dr. Aruna Kalra. I'm Director Obstetrics and Gynae at C.K. Birla Hospital. Today we are going to discuss infertility issues. Infertility means that we are not able to conceive even after unprotected intercourse for more than a year. We are not alone, or you're not alone if you're not able to conceive. It's a very common thing. Almost 10 to 15% couples are not able to conceive. And we have very simple methods to explain to you that it's not always a serious problem, and there are many easy methods which, if we follow, you're able to conceive very easily. So, and we know that in fertility, there are two people involved. One is female and other is male factor. So 30% factors of infertility are because of female factor. Another 30% are because of male factor. And rest can be because of both male and female are having some or the other kind of problems. So let's discuss, and first let us know what can be the causes of subfertility or infertility, and we would like to discuss it in question answers form. In that form, everybody is able to discuss their own issues and we are able to answer them one by one. So first would be causes of infertility in females. If I'm not able to conceive, whether my menstrual cycles are regular or not, whether my sexual frequency is good or not. So nowadays we know that we are really busy in our jobs. We are not able to get time for each other, and first factor most of the time is because we are not able to get time for each other. Sexual frequency is really less. What we need is sexual frequency after every alternate day or after every 2 days. At least we should cover fertile days, and we should know what fertile days are. So if we are not able to have intercourse after every 2 days or after every alternate day, chances of conception decreases. What is fertile window or what is fertile period? One thing, if somebody is getting regular menstrual cycle, which is between 21 days to 35 days. So regular menstrual cycle does not mean that you should be having 28 day cycle exact. You can have 25 day cycle, you can have 34 day cycle, but it should be between 21 and 35 day cycle. And if you have a regular cyclicity, say we see 6 to 8 months previous cycle, and if you have a regular cyclicity, how to calculate fertile period? So let's calculate together. If I had my period on 1st of this month and I think that my periods would be on 28th of this month or 30th of this month, I should be calculating or deducting 14 days from the tentative date, which is next cycle. So if tentative date of next cycle is 28th, we should deduct 14 days. And which day does it come to? It is 14th day. So 14th day is your most fertile period or most fertile day. So if it is most fertile day on 14th day, but we are not sure that it would be only on 28th day, my cycle or my periods next time, it can be 30 days or it can be 26 days. So we should be doing every alternate day from the center date. So center day was 14th day. We should be doing intercourse on 12th day, on 10th day, like 2 days prior to that, and 16th day and 18th day, 2 days post 14th day. These 5 days would be our most fertile days and most fertile window. And you should follow fertile days. At least during those 5 days, you should be doing love making. If your cycles are regular, you would definitely conceive within 6 months. Anybody who is less than 35 years of age would give herself time with unprotected intercourse following good fertile windows for at least a year before going to doctor. But if you are more than 35 years of age, you should give yourself 6 months time of good love making frequency. And if you are not able to conceive within 6 months, unprotected intercourse with good love making frequency, we should be going to doctor. So one thing that we should give time to each other. Menstrual cycle should be regular, and this is 90% of time tells us that you are ovulating regularly. What next can be a problem? If you are ovulating properly every month, then we should see whether you have some kind of vaginal infection or uterine infection which is not letting sperm come up, or embryo is not able to lodge properly there. It is getting infected every time. So any kind of pelvic inflammatory disease should be treated. If your menstrual cycles are painful, if your menstrual cycles are irregular, there can be a reason which is called endometriosis, as we said, pelvic inflammatory disease, or fibroid or polyps. Any abnormal pathology in your uterus can cause subfertility or infertility, and we should go and get ultrasound done to diagnose what exactly is that. If our menstrual cycles are delayed by 35 days or are coming very early after every 20 days or 18 days, what we should be doing is after every 35 days or after every 45 days or a cyclicity of 2 months or after every 60 days tells us that whether we have any kind of hormonal imbalance and whether we might be coming into polycystic ovarian disease syndrome bracket. And we should check whether our BMI is high, whether we are obese, and if there is some kind of hormonal imbalance which tells us that we have PCOS, we should correct it. Thyroid problems can cause subfertility. Hyper or hypothyroidism both can cause subfertility or infertility. We have a lactation hormone which is called prolactin. Prolactin, if it is high, can also cause infertility. And how to test prolactin? We should be doing fasting test. Blood serum should be taken, but it should be morning fasting. First sample should be taken 4 hours after getting up in the morning. After first sample, we give 30 minutes rest, and again one sample to be taken, and again third sample to be taken. So if we are taking 3 samples, this is called pooled serum prolactin level. Pooled serum prolactin level should be less than 20. Our fertility would be good. If it is more, then we should be starting some kind of treatment to suppress it or decrease the prolactin level, and it would enhance our ovulation. So till now what we summarized is that menstrual cycle should be regular. We should not be falling into PCOS. Thyroid should not be there. Hyperprolactinemia should not be there. Any kind of uterine pathology, fibroid, endometriosis, pelvic inflammatory disease should not be there. And if our cycles are prolonged, we have PCOS, or if our cycles are shorter than 20 days, we should be vigilant that whether we are going into premature ovarian failure. And we should test our fertility status, our AMH level, FSH, LH level, to see whether our fertility is decreasing or our number of eggs are decreasing. So menstrual cycles are very, very important. If somebody comes to me and tells me that my menstrual cycles are not regular within 35 days, I'm really happy, and I can tell that she is ovulating properly and she does not have any kind of hormonal imbalance or uterine pathology, and she would be able to conceive within 1 year. But if there are some issues, we would want her to go for ultrasound and hormonal test to check if there is any abnormality. If somebody has undergone cancer treatment, chemotherapy or radiotherapy, or if somebody is undergoing autoimmune treatment for autoimmune diseases, which can be steroids or some treatment for skin diseases, again we should check into it, because all these things can cause problems in fertility, problems in ovulation, and if we are taking some steroids or anti-epileptic drugs or drugs for hyperthyroidism or tretinoins for skin abnormality, we should check with doctor whether we should give some pause for these drugs to come out of our body, and only then we should be able to, or only then we should be going for conception. We should test ourselves for genetic diseases if somebody in our family is having some kind of genetic abnormality. Thalassemia being one of the genetic problem which we should test in both husband and wife. And there can be many other genetic problems which we should take proper history in your cousins, in your first cousin, second cousin, and we should check you and then treat you. Anybody who is trying to conceive after the age of 30 or otherwise, we should start taking vitamin B6, B9, B12 combination drug. These vitamins, they help in DNA multiplication, and we need stores of these vitamins in your liver 3 months prior to planning pregnancy. So all these things we should be starting in 3 months prior, and chances of Down syndrome are really they decrease to a tremendous level if we are taking B6, B9 and B12 vitamins 3 months prior to conception. So we should be this is about female fertility, and about this is if menstrual cycles and if uterus is abnormal. But after checking everything, there can be a pathology in fallopian tube, and fallopian tubes are blocked, or because of infection we are getting repeated tubal pregnancy, which is called ectopic pregnancy. So we should be treating, if somebody has had a previous abortion, if somebody has had an ectopic pregnancy, we should be treating a second fallopian tube, and we should be treating this for a lengthier course of antibiotic, with the lengthier course of antibiotics, so that there should not be a recurrent fallopian tube pregnancy again. So this is again if somebody is having repeated miscarriages or one already fallopian tube pregnancy has happened. Here I would want to tell people that as a contraception, they should never go for morning after pills, because they are also they cause fallopian tube pregnancy, because they make your uterine environment hostile, and pregnancy is not able to lodge in the uterine cavity. But if pregnancy has already happened, it will go and get stuck to fallopian tube. So we say that please do not depend on, or do not use morning after pill as a contraceptive device or as a contraceptive method. For that matter, if you are very sure that you do not want to conceive for 1 year or 2 years after wedding, after marriage, oral contraceptive pills would be the safest bet. In males, what can be the reasons for male factor infertility? Again, first thing would be if we are maintaining a very unhealthy lifestyle. Smoking can cause can actually deplete both the gametes. It can cause ovulation problems. It can cause sperm decrease in sperm motility, decrease in sperm concentration. So smoking is very unhealthy. Alcohol consumption should not be more than moderate, or I would say not more than 1 peg or occasional only. So smoking, alcohol should be avoided. Sauna, jacuzzi for men, because it gives a heat environment around scrotum, and scrotum is or testicles are outside our body for some purpose. Inside our body, temperature is really high, and testicles need cooler temperature. That is why they are outside our body. And if we are using lots of sauna or jacuzzi, or people who are chef, or people who are working in navy or other occupations where there are heated environment around, chances that sperm motility would go down, sperm concentration would go down, are very high. So men should refrain from, if they are planning for conception, they should refrain from all these things. Synthetic undergarments should not be worn, and then you should also be taking nice amount of vitamins. uh, you can have, or somebody, sometimes you might have had contracted mumps or rubella in your childhood, and that can cause low sperm count or no sperm count. And same way, there are very very treatable conditions. Sometimes testicles, when they transfer sperm towards penis, the duct is called that the duct is which is going through is surrounded by veins, and if those veins are enlarged, which is called varicocele, uh, varicocele can enhance the temperature around your penis, and it can again kill the normal healthy sperm during transfer. So we have to check with pelvic ultrasound whether you have varicocele, and it is a simple operation, we can treat it. And we should check if there is azoospermia or no sperms at all. We should check testicular biopsy whether sperms are able to like whether your testis is able to form those sperms, or whether there is a genetic abnormality which is called cystic fibrosis, in which sperms motility is decreased or less. And so there can be many reasons for male factor infertility, and unhealthy lifestyle, obesity are most of the factors which we can treat, and there are many treatable factors if we go to urologist on time. And other factors can be, sometimes we are not able to perform properly. Ejaculatory dysfunction can be one of the reason, or erectile dysfunctions can also be one of the reasons. And then we have to test testosterone levels and hormonal levels for you, and after testing we are able to help you out with simple treatment options. So male or female factor infertility or both can be there, and that is why we test one after another, or sometimes parallelly, because it is easy to check semen and it is difficult to check fallopian tubes, which is a little painful procedure. So we check parallelly both the partners and treat parallelly both the partners. How to diagnose, and another thing would be how to treat. So I would say that first thing which comes to my mind is that as soon as somebody comes to my clinic, couple, when they come to my clinic, and I ask them, again I'm repeating this, that they have such a hectic lifestyle, they do not have time for love making, and suddenly one day they wake up and they say that, oh my god, I'm more than 35 and I want to conceive. And as soon as they realize that, they think that in one or two cycle they should conceive. They start following their mobile for fertile windows and everything, and sometimes there is performance anxiety, and some other time there would be no time for each other, and then there would be fights if there are and when that window is gone and they are not able to do so. I would say that stressful ovaries do not ovulate, and if male partner is again stressed, it is very difficult. There would be performance anxiety, there would be performance failure. So do not make it as a task, do not make it as a baby project. Please, you have to understand that it's a natural process. It should be simple love making, and every time when you are trying to conceive and you get your periods, you should not be disheartened, because it takes time. If I would say that what are the normal chances of percentage of conception every month, you would be surprised that it is only 25%. So if I say that what are the chances of conception, 75% chances that you would not conceive in one cycle are there, and only 25% chances that you would be able to conceive. So see how less are the chances of a natural conception per cycle. You have to accumulate all the cycles, and only then you get best results. So that is why we say for a year, if 10 couple they are trying, out of 10, 7 couple would conceive but it would take 1 year time. And unprotected intercourse and good amount of good frequency of intercourse is required. There are few myths related to intercourse, related to how to do it and whether we should lie in that pool of semen after lovemaking. So I would tell you that it is not required. The sperm which goes through ejaculation goes to uterine cavity or in the cervix, and you do not need to lie down for 15 minutes, or you should not put pillow below your pelvis for better chances of conception. It is not required at all. So this is total myth. And just after intercourse, get up, go pee, clean yourself and sleep. This myth is like, this is wrong, which many people follow. Second would be obesity in both partners. Obesity would, one thing is restrict successful lovemaking, and second thing, it actually disturbs hormone in both the partners. And in females, it hampers ovulation, and if somebody is obese or with higher BMI, chances of ovulation per cycle would be lesser than if you have a proper or optimum BMI. And same goes with the male partner. So you have to maintain a healthy lifestyle, and because we are having sedentary lifestyle nowadays, which is a new addiction, everybody is sitting in front of computer for say 10-12 hours or more. You are exposed to screen time, which is light, which actually suppresses melatonin, and it actually causes all hormonal imbalances. So screen time should be less, and you should be getting up after every hour. You should be maintaining a healthy lifestyle by going to regular exercise, and if you are not able to join gym or something, please go for 60 minutes walk morning, evening, to declutter your mind, to have a good breath outside, increase your tidal volume, take oxygen inside, give oxygen to your muscles, your bones, and have a stress-free declutter time for yourself. So 60 minutes walk morning, evening. In your diet, you should be having almost 50% of your diet should be fruits and vegetables, 30% should be proteins, and only 20% should be carbohydrate, and that too with high fiber carbohydrate, which is either dalia, oats, and it should not be instant anything. You have to cook it, and only then you should take it. So instant carbohydrate, easy carbohydrate, which is bread, bakery, or vermicelli or poha or pasta, should be avoided, because we are not doing all that much work, and we should not be taking much of carbohydrate. It is not required for the sedentary lifestyle which we are following nowadays. There are so many other things, like how to diagnose whether I'm ovulating or not, whether my fallopian tubes are blocked or not, whether I need surgery for fibroids or endometriosis, or if I found out that I have some or the other abnormality, what are the treatment options for me? I would suggest people who are watching, please come forward and write your questions in comments box, so that I'm able to answer one by one, instead of it is a one-way lecture, which could be very boring. So Sugandhi, Mohammed Tariq, Sunil, please, every one of you, ask me questions and I would be able to answer your queries. Hi Nisha, or you want me to go on like this, lecturing? So anyone, will you please write in your comment box that whether you want me to go on like that, or you would be watching some good questions which can help everyone understand this problem. Okay, so nobody is coming forward with questions. When you go to a gynecologist and gynecologist starts that, okay, now it's been a year or more than 6 months and you are not able to conceive, let's do some tests for you. So what are those tests? First list of tests would be simple preconception tests, which would be your hemoglobin, your blood group, your thalassemia status, your status for rubella antibodies, your status for varicella antibodies, and if you have any family history of genetic disease, we would be checking that also. Sexually transmitted diseases we would like to check, which is hepatitis B, hepatitis C, HIV, syphilis, which test is called VDRL. We would want to check your sugar status with HbA1c value, and simple urine test to check whether you are having protein in your urine or sugar in your urine or ketones or some kind of infection in your urine. So all these are very basic tests to check whether you are having whether you are a genetic carrier for some disease, or whether you have some kind of pelvic inflammatory disease which is viral in nature, which can be transmitted from one partner to another or in utero to your baby, and if we are able to treat you immediately. We would like to test your thyroid status, and sometimes you need thyroid medicine to keep your thyroid levels or TSH levels in control. And another thing would be we would want to check your prolactin, and with prolactin we check whether it is high, and if it is high, ovulation would be difficult, so we would want to treat prolactin levels also. So these are few tests, and these are for female, and for male partner we check again HIV, hepatitis B, hepatitis C, VDRL, thalassemia status, and blood group. Sugar status also would be checked, and thyroid level would be checked. And then we go for semen analysis for male partner. For semen analysis, there should be 3 days abstinence, not more than 6 days abstinence, not less than 3 days abstinence. Rashida Begum is asking, my first periods after miscarriage, ma'am, and now how should I plan for pregnancy? So Rashida, first thing would be, what was the reason for miscarriage? Whether miscarriage was in first 12 weeks of pregnancy, or it was in second trimester of pregnancy. And if it was in first 12 weeks of pregnancy, chances that it would be some kind of genetic deletion or addition of gene, and abnormality in fetus are much more common than a cause in yourself. But sometimes there is the infection, blood infection in female, or some kind of vaginal urinary infection or diabetes, and we have to treat all those factors before we plan for second conception, or definitely 3 months of B6, B9, B12 has to be given before you start planning for second pregnancy. We should check whether your uterus is having some kind of infection. We should treat that, and we do not want your uterus to again not able to hold the baby properly, and fallopian tubes should also be free of infection. Sometimes in second trimester there is abortion when mouth of the uterus is weak, and again we have to check what is the reason and whether we need a stitch after you are pregnant if it was a second trimester abortion. So I think, Rashida, you should go for complete checkup. What was the reason for abortion? And if whatever was the reason, we have to treat it first and then start planning pregnancy. Okay, so any other question? Or I was going with what are the tests which we do once you come for first consultation, once you have tried for say 6 months or a year. So semen analysis should be done, which is after 3 days of abstinence, no masturbation, no sex for 3 days, and then we should be checking semen analysis. After checking all these tests, if we find that okay, you are hormonally perfectly well and semen analysis is really good, then what can be the next thing which is causing difficulty in conception? So next thing would be whether you have some kind of uterine infection, or whether you have some kind of fallopian blockage, or whether you are not ovulating in spite of your regular cycles. So we would go for non-invasive tests first. by saying non-invasive test, ultrasound would be the first test for female as well as for male. But if semen analysis is normal, we are not going to go for ultrasound for male partner. But follicular monitoring, a test which tests that which date you are ovulating. So we start ultrasound on 9th or 10th day of your counting from first day of your period. When we count from say 9th day, we start our first follicular monitoring test. Follicular monitoring test, the ultrasonologist would give you a report which would show that there is some millimeter size of egg in right ovary and another egg in left ovary, and endometrial thickness, which is the thickness of your uterine lining, ET, is this much. Again, we keep checking day after day. So if we did first ultrasound on 9th day and it showed that multiple small follicles, we would be going after 2 days and so on. We do every alternate day or after every 2 days till egg comes out, and egg comes out mostly after egg size is 20 or 22 millimeter. Nirja is asking, my before plan is regular, okay, I'm sorry, regular periods, my also thyroid problem is there, pregnancy is possible. Okay, so Nirja, what I understood is that you are having regular periods, but you are having thyroid problem, and we would say that if you have thyroid problem, your thyroid level should be less than 3.5 or 3 for better ovulation, and if cycles are regular, you would be able to conceive properly. But to know whether you are ovulating properly or not, you should be going, as I said, if it is more than 6 months and you are not able to conceive, then we should be going for follicular monitoring. Follicular monitoring is a test every alternate day. We do ultrasound, we check whether you're ovulating or not. By the time egg size is 20-22 millimeter, that is the time your egg is about to come, which is called ovulation. So what we do is we tell you that your egg is about to come when it is 22, and please start having intercourse every alternate day or after every day from this size, and before you know, after 36 hours egg comes out. That is called ovulation. And once we know that you are ovulating properly on whichever day, it can be 14th day, it can be 16th day, 18th day, or whichever day you are ovulating, from now on we would be following that period of ovulation, and we would try to have lovemaking during those days, and it would be easier for us to conceive. So this is the simplest test which we do to check whether ovulation is happening or not. You can use LH kits also, but sometimes it's frustrating when you are using many LH kits day after day and you are not able to understand whether you are ovulating or not. Then comes the role of ultrasound or follicular monitoring, which would tell us sure that this is the day when you are ovulating, and endometrial thickness should be good to receive the baby. So after follicular monitoring, still if ovulation is happening normally, if sperm count is good, if you have no infection, or if we have treated you for infection in uterus and fallopian tube, then where can be a block and why we are not able to conceive. Then comes the last link. Egg comes out and it comes to fallopian tube. Sperm comes up from the uterus and it comes to fallopian tube. So both gametes, egg and sperm, comes to fallopian tube, and in fallopian tube fertilization happens and baby is formed in fallopian tube. And once embryo has formed in fallopian tube, it traverses towards uterus and gets attached to uterine endometrium. So where exactly can be a problem? If you are ovulating properly, if sperm count is good, if your hormonal status is good, if you are not having any kind of infection in your uterus and fallopian tube, then last we have to check whether your fallopian tubes are blocked or not. And we have to check fallopian tubes with one of the method which is called sonosalpingography, which is ultrasound, and we put saline through your cervix. It goes through your cervix into your uterus and comes out through fallopian tube opening. So we get to know that fallopian tubes are open through sonosalpingography. Another thing would be we do hysterosalpingography, which is an X-ray, and we put a oil-based dye. We push the oil-based dye through cervix. Again, it goes through cervix, through uterus, through fallopian tubes, and it gets spilled outside, and we get to know that fallopian tubes are open. Because these are a little painful tests, we keep these tests for the last, and before going for either sonosalpingography or hysterosalpingography, we should definitely check that you do not have any kind of vaginal infection, cervical infection, or uterine infection. Otherwise, with saline or oil-based dye, everything would be spread. Because once we push the dye, it goes through uterus, and if there is infection inside the uterus, it would be pushed towards fallopian tubes, and then it will be spilled outside from fallopian tubes to your abdominal cavity. So we have to treat infection first before checking for fallopian tube patency. So this is one thing. Meenakshi is asking, in my second pregnancy, the baby was Down syndrome. If I'm planning again, so can the issue come again? Okay, Meenakshi, I would say no. If you're planning again, please go ahead and plan. Try, let's see, if your age is on the other side of 35 years, then first thing would be for everybody, as I'm saying, that B9, B6 and B12 consumption is necessary 3 months prior to planning. One. Second thing is that because it is over mature egg, which can lead to trisomy 21, when chromosome 21, instead of coming one chromosome from mom and one chromosome from dad, mother's chromosome number 21 does not break, and it comes in toto or full pair of 21 chromosome, and that is why we have 321 number chromosomes in Down syndrome, and baby has abnormality. So but it is not a repetitive abnormality. We should check it with, nowadays we have many tests. We have non-invasive NIPT test, and we have amniocentesis test. So if we are on the other side of 37, 38, 40, we should go for confirmatory test rather than going for a double marker or quadruple marker. And if you are maintaining a healthy lifestyle, having good green leafy vegetables and fruits, and having a healthy fitness regime, your eggs would be good. One. Second thing, you should be planning for conception during fertile window, not to very much before fertile window or after that. We do not want aging egg to get fertilized, so we want a good quality egg to get fertilized when you are planning for conception. And please take supplements before you plan for next pregnancy. Okay, so Sejal is asking, can I conceive naturally in PCOD? Sejal, definitely you can conceive naturally in PCOD. Most of the time, if PCOD patients have regular cycles, or cycles which are, say, if you are having irregular cycles, 45-day cycle or 60-day cycle, you would ovulate sometime or the other. Chances of ovulation would be less if cycles are more than 45 days or more than 60 days, because say if in 12 months I'm having 12 cycles, menstrual cycles, chances that I would be having at least 70 or excuse me. Okay, so we would be going like that. So chances that you are having Okay. uh, Having 12 cycles which are ovulatory are higher, uh, fertility would be higher. But if you are having less than 6 cycles or 8 cycles in a year, chances of conception would be less. So it's not that you cannot conceive, but chances of conception would be less. One. But if in PCOS you have insulin resistance, your LH levels are high, your AMH levels are very high, in those cases we need to correct all these things, and only then you would be able to conceive naturally. So first treatment for PCOS would be, please maintain a healthy dietary regime, please maintain a fitness regime. Your BMI should be optimum, you should be eating healthy, you should be exercising every day, and you should try to make a healthy to keep a healthy lifestyle. And healthy lifestyle would keep a check on your insulin levels and insulin resistance. Once it is lowered, chances that you would ovulate spontaneously are really high. We do not want to treat PCOS patient with medicines. First line therapy is reduction in weight and maintaining a healthy lifestyle. Your LH-FSH ratio should be 1:1 and not more than 2:1. And your testosterone level should be normal, your insulin resistance should be normal, and you would be able to conceive naturally. And I'm giving you this advice because I do not prefer to give unnecessary medication to PCOS patient. PCOS is a lifestyle disorder and it should be corrected with correct lifestyle. Okay, so I think Meenakshi is asking, I also she has lost 11 kgs, which is very good, Meenakshi. You are doing a commendable job. And if you have lost, your ovulation would be really good. Neerja is asking, my age is 30. Okay, AMH levels are poor. Okay, so your age is 30 and you're telling that your AMH levels are poor. But see, if you are having a regular cycle and if you do your follicular monitoring and you find out that you are ovulating, then do not read too much into AMH and you would be able to conceive. But if you have been trying for a very long time and you are not able to conceive, then I think, and if you have taken many courses of ovulation induction drugs like clomiphene or letrozole, then please, if longer or multiple courses of ovulation induction drugs can lower your AMH level, can lower your fertility, and unnecessary waiting for miracles to happen, you should be going for further treatment as per your consultant. So if we find out that our uterus is having endometrial polyp, we should get this removed hysteroscopically. If I find out that I have multiple fibroids or a fibroid which is coming inside my uterine cavity and which is blocking uterine cavity or fallopian tube, I should be going for laparoscopic myomectomy, get that removed, give my uterus some 3 months rest, take hormonal pills for 3 months to make your uterus healthy after laparoscopic myomectomy, and then go for fertility, then go for family extension. ओके सनी, हिंदी में बोलती हूँ, ठीक है. ओके, तो जो हम बता रहे थे वो ये कि अगर हमें ठीक से रेगुलर साइकिल आती हैं 28 दिन की या 21 दिन से ज़्यादा या 35 दिन से कम, तो वो रेगुलर साइकिल का मतलब है कि आपको ठीक से एग बन रहा है हर महीने, जो कि 12 से 18वें दिन पर बनता है. तो अगर कोई पेशेंट हमारे पास आती है और वो कहती है कि उसे रेगुलर साइकिल्स आ रही हैं, तो हमारा 90% काम ख़त्म हो जाता है। हमें ये समझ में आ जाता है कि उसके हार्मोनल लेवल्स नॉर्मल होंगे, प्रोलैक्टिन, थायराइड, एलएच, एफएसएच, क्योंकि उसे रेगुलर साइकिल्स आ रही हैं। रेगुलर साइकिल्स और अच्छा फ्लो आने का मतलब ये है कि यूट्रस की जो लाइनिंग है वो भी अच्छे से बन रही है, तो वो भी एक रिलीफ होता है कि यूट्रस की लाइनिंग अच्छी बनना इज़ वेरी वेरी इम्पॉर्टेंट बच्चे को रिसीव करने के लिए। फिर जो काम रह जाता है वो ये कि इतने सालों से 6 महीने या 1 साल से क्यों कंसीव नहीं हो रहे। अगर हमारे रेगुलर साइकिल्स आ रहे हैं तो क्या परेशानी है। तो कई बार होता है कि रेगुलर साइकिल है मगर बहुत पेनफुल है, और बहुत पेनफुल है तो वो इन्फेक्शन भी हो सकता है, वो एक और डिजीज़ होती है जिसको एंडोमेट्रियोसिस कहते हैं, वो भी हो सकता है, और कभी कभी फाइब्रॉइड या पॉलिप भी हो सकता है। तो अगर कोई भी ऐसी तकलीफ़ है जो कि हमें समझ में आती है, पेनफुल पीरियड्स हैं, पीरियड से पहले बहुत दिन पहले पेन होना शुरू होता है, तो हम उसको डायग्नोस करते हैं, उसको ऑपरेट करके निकालने की कोशिश करते हैं। और आजकल एंडोस्कोपी, हिस्ट्रोस्कोपी, लेप्रोस्कोपी के ऑपरेशंस के ज़रिए हम लोग